UroPatient. Tune in and see a plan with your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning and welcome to UroPatient Podcast. I'm your host, Vic Senese. Nice to have you here today. Hey, if you haven't liked and subscribed, what are you waiting for? Like and subscribe. So today I've got a great show for you today. Last week we talked about penile enlargement and, kind of some of the things that they've done and really whether it needs to be done or is this just cosmetic. So to complete things, I thought, we didn't really come into the actual treatment. So I'm going to have Dr. Joel Pash, as I mentioned before. He's going to come in and talk about it because he does this particular surgery. It's cosmetically making the penis enlarged. So we're going to talk about what he's going to talk about what this is. And we're going to go ahead and talk to him right now.
Okay. So as you said, I'm a board certified anesthesiologist. I started Upsize about 4 years ago now, and we've done I've personally done 1,500 or so male enhancement procedures. I think if you combine all our doctors, we've probably done 4,000 or 5,000. So I thought what I would do today to start out is just go over the options that exist for male enhancement. Obviously, I lean towards the way I do it as the safest and what I think is the best, but I figure I'll cover all of them. So now onto the fillers. We can break that down to permanent fillers and temporary fillers. We do temporary fillers made of hyaluronic acid, which is the same filler that's made that women will use to put in their lips or their face typically. But let's talk about permanent fillers first, because we'll cover what I do last. So permanent fillers can be anywhere from silicone to PMMA, which is like plastic little particulate things, and they are like micro particles. The intent of these is to also inject in between dartos fascia and buccal fascia. And the theory is that your body has like a response to those fillers that causes collagen formation. And then it's thought that collagen formation can be permanent. The issue though with permanent is that all the fillers, including the hyaluronic acid fillers, have some degree of revision necessary. And when you have like a permanent filler that has a subpar result, either you can sometimes correct it with filler, but you can't remove it without surgery. So we see a lot of people that get these fillers for whatever reason, it doesn't look good or they're not happy with it. And now they're getting their penis cut open to get this stuff removed. And then of course you get permanent issues like adhesions, which can make your penis shorter, and trauma to the nerves. So, a lot of time they have permanent erectile dysfunction after that. Now, lastly, the hyaluronic acid fillers, which is what we do, are kind of an ideal male enhancement technique. It's also injected in between buccal fascia and dartos fascia. It uses the way we do it, at least, uses a aesthetic microcannula. So it's not sharp. So it has a very low chance of traumatizing any structures that you don't want to traumatize, like veins, arteries, or nerves. The filler that we use lasts about an average of 2 years. It will cause thickness or girth, which is basically what all of the other things we just talked about does. And it'll also cause some flaccid length increase. It does that because the penis basically gets heavier and has this material in it that works like a scaffold kind of. So basically the length increase is due to the penis not shrinking as much because shrinks and expands all day. So we tell people they can get about 3/4 of an inch of flaccid length increase, but no erect length increase. I always tell people getting erect length increase would be kind of like trying to increase the length of your arm, right? You would have to cut it off, graft in skin, blood vessels, nerves, arteries, veins, muscle, bone. So it's obviously impossible, but it is very easy to make your arm thicker just by putting fat in. If you gain weight, it'll get fat in it, or you could put any sort of material underneath the skin. There is some, so back to the fillers, there is some rate of correction necessary, but the filler can be easily dissolved with an enzyme. So if you have an asymmetry or a lump that you need dissolved, it's a quick injection with a 30 gauge needle. It dissolves immediately, and it can be revised by adding small boluses of filler in whatever areas need to be revised. So I think I'll end it there. I kind of covered every possible male enhancement option.
Real complications, and maybe you can elaborate on what complications you see with using this. Are there any side effects or erosion of the material? Or
yeah, so the only, like, practically speaking, the only complication I've ever seen is infection, which is quite low. Like, I could speak for myself. Out of doing, let's just call it 1,500 procedures, I've had 5 infections maybe. So that's probably equal to or better to than what you would expect with any kind of medical procedure. A medical procedure in general probably has 5% chance of infection or something. In all those cases, we just give antibiotics and it gets better. I've never had anything that hasn't gotten better with antibiotics. And of course, since it's dissolvable filler, the worst case scenario, you just dissolve all the filler. So whereas if you have an infected, non-dissolvable foreign body, that could be a problem, right? Because for an implant, you might have to actually surgically remove it.
Right.
In terms of what we do to minimize those complications, well, first of all, we have pretty much a standardized protocol as to how to do the procedure. So everyone we teach, we kind of expect them to be doing it the same way, and that way has been done thousands of times now and has kind of proven to be safe. We use, as I mentioned before, aesthetic microcannula, which when injecting dermal filler is pretty much well established that it has a decreased risk of vascular occlusion, which is a risk of dermal filler, and has a decreased risk of traumatizing anything like nerves or blood vessels. Or, in this case, there's some theoretical possibility you could puncture the urethra or the corpus cavernosum, although you would have to be incredibly negligent and not know what you're doing to do that because they're not in the same area that we're injecting. But nonetheless, using something that's not sharp, substantially decreases the chance of that happening. In terms of comfort, there's a couple ways that, so the main thing of comfort is just numbing everything properly. Once you get everything numb, there's no pain. So
you do a local block?
I just do local. Yeah. There's some.
Was the procedure one and done, time you come in, have the enhancement and you're finished? Or is it something that typically has to be done over a course of time? Or
the technique that I do, or that the Upsize or Urosculpt providers do, it's usually 80% of the time it's one time. People that want a reasonable size increase, it's one time. Some people, by the way, the amount of girth increase that you can get is anywhere from a 1/4 inch in circumference up to like 2.5 inches in circumference. So, 2.5 inches in circumference, fairly, that's a very generous size increase. So sometimes if you need a lot of filler put in, it might be 2 visits, but typically it's 1.
So what are your post-op instructions to the patients? What should they expect? How soon can they resume having sex, etc.?
Sex, we tell them to abstain from sex for 1 week. that's mostly just due to prevent infection, not, you have some little scabs and little needle holes in your skin. So we just don't want to break those open. Other than that, there's not much post-op instructions. There's some chance that you would need to do some shaping or molding of the filler. So we'll show them, if you have a lump here, just like squeeze there and and move the filler back into place. But that's rare even. And basically go back to the gym the next day kind of thing.
Much bruising? I know like Xiaflex, you see these huge black and blue penises from or Pyrones.
There'll be substantial bruising. Never had any, like I've literally never gotten a phone call saying I need pain medication or can you, give me.
Are there any big red flags that people, patients that are looking to get this done that they should look for? They should look for certification, that, ask those kind of questions. Anything else they should know when they walk into an office, whether they think this is legit or not?
Yeah, obviously certification is a big one. We're hoping that we become the standard in certification because there isn't one right now. Always, whether it's a penis procedure or a spine surgery or whatever, find out how many your doctor has done and what the outcomes are. Ask to see before after pictures. Is this their first procedure ever, or have they done 1,000 of them? And in fairness, anyone that learns how to do it has to do the first one at some point.
You have to have your first patient sometime, right?
So there's I'm a little cautious of saying that you should only see someone that's done 10,000, but if they have certification and they've done the right training.
What the cost is for this procedure?
The cost ranges from about 4,000 to the sky's the limit kind of thing, but the prices are on the website, so it's honest pricing, and the average cost is about $7,000 for the procedure. It's
not covered by insurance. That's out of pocket.
No, this is as it's like, look at it like breast implants or butt implants or facial fillers or Botox. People get their lips injected. It costs $800 and lasts for 6 months. So, and this lasts a lot longer. These things are just expensive, and part of it's a function of drugs being expensive in the United States. The filler we use is literally 5 times the price what it is in the United Kingdom, for example, and about 3 times the price of Canada. So there's that.
So as you can probably see, that penile enlargement, there is a procedure. It's cosmetic surgery, like having your, women getting their boobs enlarged or having your lips made bigger. All these cosmetic fillers can be used, and the same thing can be used in the penis. So if it's something that you're really seeking out, you got to understand you're going to probably be paying out of pocket for it, or should be paying out of pocket, because most insurances aren't going to cover it. And it's kind of talked a little bit about the expenses, but find a good reputable person if this is what you want to have done, and make sure you go to the right person. Hey, next week, just got your PSA back and it's elevated, high PSA. Hey, don't panic. It's not quite time to get worried right now. So I'm going to talk next week about what you should plan on doing for your next step. Once you find out you have a high PSA, what's going to happen and what do we do, and kind of hopefully reassure people what's coming up. So with that, hope you had a great show here, and we'll see you all next week.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see. Baby, your health for you and me. Knowledge is power. We make it clear. Every Saturday morning, the podcast is here.